Hi, I'm Ben. I'm here to talk to you about using leeches for Miralgia Paresthetica therapy. Now I know that's a big word, but what it means is that if you have Miralgia Paresthetica, you have pain that goes down the front of your thigh. And it's caused by usually some sort of entrapment of the femoral cutaneous nerve that goes under the inguinal ligament. That nerve becomes irritated and inflamed. And this can cause intense pain all over this leg. Of course, other things can cause that too, such as spinal impingements. But I want to talk to you about how I'm going to treat myself with leech therapy. Why do I use leech therapy? I use leech therapy whenever standard orthodox medicine falls short of my expectations. What have I got to lose? May work, may not. So far it's always worked. I've used it for blood clots, I've used it for arthritis and Miralgia now. Of course, many people have been using leech therapy for hundreds of years, use it for many other conditions, and it's widely researched. A lot of publications done on this. The Russians have done some fantastic work, research work. In fact, some research companies, such as Bayer, have even used the leech peptides in some of their newest formulations. The chemistry that leeches have to offer can do exceptional things. For example, if I had some sort of pulmonary disease, emphysema or something, this would be one of the things I would add to the standard list of treatment. But anyway, we're here to talk about Miralgia. I'm not going to put the leeches on me today in front of the camera because I would have to pretty much disrobe and I'd get a lot of bad email from that. But I'm going to describe what I'm going to do. I'm going to show you what the leeches look like and how I go about handling them. Because should you ever make up your mind to use leech therapy, you need to know what to expect, right? Right. Okay, the first thing, if you order your leeches will arrive by mail. They'll be at your doorstep, usually in a box in either a thermos or some sort of plastic container. I think my last delivery was in a container like this. Whatever. It will be delivered to you usually within about 3 days of when you order it. They can be bought on the internet. Generally, prices run from about $8 a leech on up, depending where you get it. And usually the delivery fee is a one-time fee of $25. Okay, you got your leeches in. What do? The first thing you do, because you're not going to be ready right away, I put them in a jar, and then I put them in a refrigerator. Keep them cold, keeps their metabolism down, keeps them under control. I mean, you don't want these bad boys dying on you before you give them a chance to have dinner on the house, so to speak. So I put them in a jar and cover it with foil. Now, these little nylon foot things that my wife gave me are great for covers. Just put it over the jar lid, lets the leeches get air into their water, put a rubber band on it to hold it on. So that's how you can store them. When you get ready to use them, put your leeches out of the refrigerator for a day to warm up and acclimate to room temperature. Now, know this. When the leeches arrive, these little critters are hungry. I mean, they're looking for the big meal. So they're going to bite just about anything that comes their way. It doesn't matter whether it's a pencil or a glove or whatever. So they're a little tricky to handle, and I'll try to put you at ease on that a little bit. Once they've fed, they just roll off. They get probably maybe 10 times their size, and they just roll off and take a nap, and you can pick them up in your hand. They're like gentle caterpillars. You can play with them if you want, whatever you decide. But they're kind and nice once they've had a good meal. So let's begin. I want to show you what a leech looks like, a hungry one, and how to deal with it, because he's going to stick to whatever I put in that jar. First thing I'm going to do, always wear gloves. or at least it's a good idea to. And we're going to try to get some of these critters to stick to whatever I put in there. I think I'll just put a pencil in there and see if we can pull out a leech or two. Okay, I've got 6 of them in here. Whenever I order at least 6, sometimes 10, because when you use them, chances are you're going to probably lose one. He'll get away from you, get on the floor, get covered up in cobwebs or something. You'll never see him again. Or you may have one that's just not hungry. So I always allow 2 for error, so to speak, or Murphy's Law. Okay, let's put a pencil in here, see what happens. And of course, as Murphy's Law would have it, nothing will happen. So didn't really count on that. Let's try to put a finger in there. And they're thinking about it, but they're not sure exactly what they want to do. I've got 2 or 3 cornered here. Now these leeches are holding on to the jar. For some reason they think the jar is a better deal. Okay. Now, before these guys climb out, I'm going to put this little nylon back over it. Here is a leech. This is a small leech. It's going to be very hungry. Somehow, I could tell you that the leech just ate the tip of that glove off, but that would be a lie. I don't know what happened to that. Okay, you've got this leech here. He's very, very hungry. It's going to be hard to get him where you want him because he's trying to feed on my glove. But ultimately, I need him in some kind of container. So I'm going to put a container out here. Now, of course, he's not going to want to go where I want. So I am going to threaten him at knife point. I'm just being silly. What I do is, because he's attached so tight with that sucker, I'm going to just get under the sucker and scrape that off. There. He's now in the little container. If you don't have a sharp-edged tool like a knife or something, then be very careful, because remember, he's about to feed on you and he wants to get out. Now your next move, I want to mention it real quick, where I'm going to treat Miralgia, which is up here where the lateral femoral cutaneous vein comes through. I'm going to just take this, slap it upside down on my skin, and in about 3 or 4 minutes, this bad boy is going to be having the dinner of his lifetime. I'm going to put him back in here, or not. Looks like he's got other plans for dinner. Oh, okay, there he went back in. Now, the biggest problem is fear. It's natural to be scared of these guys because you don't know how to control them. You've never been in this situation, and you've got all kinds of fears. You know, what if he crawls up my arm and everything? Well, you know, worst comes to worst, you can always just grab him and pull him off. It's easier to try to, you know, not kill him doing that and take a knife or something and scrape his little suckers off. But there's really nothing to fear, just fear itself. But I was that way the first couple of times, scared me to death, but got through it okay. And now I kind of enjoy these guys. You know, it's kind of fun to name them, and they enjoy swimming and socializing, and they're just really interesting creatures. The thing that's important to know is that these must be a particular variety called the medicinal leech. Arudu medicinalis is the exact name. They have the exact peptides that you need for whatever condition you're trying to treat. I would personally use this on anything where orthodox medicine wasn't really doing anything. I found that it cured my arthritis. I wasn't even intending to do that, but it just did that automatically. Helped with my blood clots, yada yada. But you've got to be aggressive. You have to be the kind of individual that doesn't mind taking some risk. You don't want to use these if you're in an immune compromised situation. If you have some disease that your immune system is being compromised for, these critters do carry bacteria like just about everything. And although I've never had any problem with it, and I don't do any special preparations, if you don't have a working immune system, just surface bacteria can cause a problem. Now, I'm not a medical doctor, of course you've gathered that by now, but I can't tell you to do this or anything. That would be irresponsible. But I can tell you how I treat myself. You know, as we age, we begin to kind of fall apart in more ways than one. I mean, I am older than a fossil, but you probably wouldn't know it. I still try to engage in sports, such as they are, as best as I can. But the trick, I think, is to keep pushing for good health. If something hurts, fix it. So these little guys are one of my alternate lines of defense. I think I've covered everything pretty well. When you get done, you can either put them in a jar. For instance, on the back dresser there, you'll see a couple jars. I have some leeches swimming in there. They've been in there for months. They're just kind of fun to watch. They don't eat anything because they've already had their meal. They'll last on that one meal for 6 months, maybe a year. So you've got your own supply of leeches the next time you need them, or you can buy hungry ones. You need to understand that if you don't want to keep them, you can euthanize them by putting them in rubbing alcohol. I hate to say them euthanized, but you got to do what you got to do. Other than that, I hope this video has been useful to you and to those rare people that are sort of at the end of the ropes for other alternatives. Perhaps this is the one for you. Thank you and have a great day.